Okay, perfect. You can start. What's up? Let me see if they're muted coming in.
That's cracking. Designed to run. Carrying North London Underground. Yeah, it's really good.
Okay. We will wait 1 second, then start. Hi everyone, thank you for joining us for today's virtual dental shadowing session. We want to remind you that today we do not have the quiz just because we have a dental student. All right, let's get started. I want to thank Kane Harris for today's session. You can get started whenever you want.
Okay, so thank you for everyone interested in listening. So I'm in my third year of dental school at the University of Manchester, so I'm just going to be talking a bit about what I do, what a day in the life is kind of like, answer some questions about what dentistry might be like in the UK, and any other questions you guys might have. So just a bit of background information on me. So I was born in Wolverhampton in the West Midlands, so as the name says, just to the west of the middle of the country, but now I'm in Manchester, so in the north of England. So here's a picture of the University of Manchester. So University of Manchester is famous for introducing the world to nuclear physics. We discovered the structure of the atom. Alan Turing went there. It was the first place Einstein lectured when he came to the UK. So a very great uni. The dental school, on the other hand, isn't as nice. It does have asbestos in it, but we make do. Next slide. So yeah, in the UK, we don't have to do the DAT. We have a similar version now called the University Clinical Aptitude Test. However, it's not a dental exclusive exam. People do the same exam for medicine as well. So the questions are quite generic. And rather than testing teachable content like your biological, chemical knowledge, it tests things that you can't teach somebody. So it's things like verbal reasoning, decision making. It's essentially an IQ test. And again, as you can see on the screen, dentistry in the UK is a 5-year course, and it's undergraduate as well, which means that you can start dental school as soon as you finish secondary school, so as soon as you're 18, and then after that 5 years, you become a foundation dentist or a junior dentist, and then you only have to do 1 more year until you're fully qualified, which means you can be a fully qualified dentist by the age of 24 or 23, which is really great. Most dentists in the UK will go on to work for the National Health Service. However, a lot of those, they will offer private work at the same time. So most dentists in the UK are like a mix between public workers and private workers. Just because the NHS is quite secure for giving people jobs fresh out of dental school. So just what is a typical day like at a dental school where I am? So the University of Manchester. University of Manchester is quite proud of something that they call inquiry-based learning, which means that we don't learn by traditional lectures. Instead of like having big lecture halls and one lecturer at the front, we tend to learn things in small groups instead. So we have groups of around 10 with a tutor, and we tend to learn by looking at case studies. So every week we'll get introduced to a new case study based on a real patient, and then we kind of discuss it as a group. We choose our own learning objectives, and then we go away and learn them and then come back and discuss it. So it's very personal, very kind of like personal reflection, peer feedback kind of way of teaching. And then aside from that, kind of the clinical side that we get, we have to run our own clinics in the dental hospital. So we start seeing our own patients at age 20, so very young to be like managing your own workload like that. We also get clinical skill sessions, so practicing on like the phantom heads. We get sent to outreach as well, so we can go to dental clinics in the local area, and sometimes we also get sent to local schools as well. So we'll go and do like kind of like public health dentistry, pediatric dentistry in primary schools, so that's teaching children how to look after their teeth and things like that. And then we can also do hospital placement, so we might get sent to shadow like an oral surgeon or a maxillofacial surgeon. So quite a lot of things you can do. A little bit about choosing dental schools. I know a lot of people put a lot of thought into this. My thinking behind this is that most dental school teaching is governed by some kind of national body. So in the UK, it's the General Dental Council, but other countries do usually have their own. And they tend to dictate what dental schools have to teach in order for those students to be qualified dentists, which means that the curriculum across different dental schools ends up looking pretty much the same. The only thing that tends to differ between them is the order that they teach you things in. So if they do orthodontics first, or do they do perio first, things like that, and the style of teaching. So is it lecture based, or is it like where I am, inquiry based? And then some other factors you might think about. Do they offer early patient contact? Do they get early clinical exposure? And also just the way the course is laid out. So at Manchester, we have integrated learning. So when you have your kind of biological sciences and then your clinical science, we kind of learn those simultaneously through all 5 years of dental school. Whereas some other dental schools in the UK, Birmingham, for example, they do all of their bioscience in the first 2 years, and then the final 3 years is purely clinical. So it just depends how they lay out the course, but the content will be exactly the same. And then a few other things people might think about is like entry requirements, distance from home, financial incentives. So here, where I am, I got offered £2,000 a year to study here if I went to another dental school. So some unis do that for you. And of course, postgraduate opportunities. So what they might offer you after your undergrad. So when it came down what came down to me, making my decision where to go. So I got offers from a dental school in London, King's College, which you can see on this picture here. And the dental hospital at King's College is really cool because you can see the Shard on the right there, but the building to the left of that, that's the dental hospital. Well, it's a hospital, but the top 5 floors is just a dental hospital, which means that you do clinics and you get like a full 360 view of London, which is really cool. And then my other option was Cardiff, which is the bottom pictures. It's very different. So I went somewhere in the middle with Manchester, so not too big of a city, but not too quiet either. And then just a bit about dental specialties. On the left, I've got a list of different things you can do after dental school if you want to. So the green ones are kind of like your bread and butter dentistry, what you'll tend to be doing in practice every day. The blue ones are something you'll have to do a bit more put more work into. So things like prosthodontics, looking at dentures, or implantology. And public health is something I'd definitely be interested in. So kind of working out what groups of people are more vulnerable to different diseases, really, really nice. And then the bottom 3 of ones I just put in red because people don't really think about them as much. So there's a military dentistry. You can work in the armed forces, in the Navy, and just travel with them and essentially be a dentist on a boat. You can do forensic dentistry. So if there's any cases of murders with like bite marks on them, they might have a forensic dentist come and analyze those. I think in the UK we only have about 30. Don't know how it matches in other countries, but yeah, it's a very, very rare profession to get into. Or you can go down the business side of things. You can just go into owning your own practice, selling it, and just a bit more of an entrepreneurial role. And a couple tips I'd have to say on like choosing a specialty. From what I understand, we don't have as much pressure on us in the UK to specialize, just because we're pretty much guaranteed a job in NHS, and it's just whatever the demands are in NHS kind of dictates. Everything else is quite easy. So I just say like dentistry is already a specialized field, so you don't have to specialize. You can be a general dentist. And of course, if you enjoy what you do, it's not work. And yeah, the only other thing is use your connections at dental school, because there's so many people you come into contact with, so many different consultants in different professions. You're only at dental school for a short time. Just really use those, try and get some shadowing opportunities, advice, as much as you can, really. And then just a last little quick thing before we just go into a nice Q&A session. I got asked to do a few tips on staying motivated. So my first one is always have an overarching plan of what you're doing. You can't plan something or be motivated for something if you don't know what you're being motivated for. So that's my first step. The second one is something I have to tell myself every day. Dentistry isn't supposed to be easy, or as one of my tutors says, if dentistry was easy, everyone would have a Porsche. So it is okay. It's normal to feel stressed on a course like this, or if you do get into dental school, it's just something you have to manage. The third one is something my biology teacher in high school actually told me. Funnily enough, he was from Canada. So definitely words of wisdom here. He told us every decision you make, no matter how small, brings you closer to or further from your goal. So he said on life, there's 2 sides on a balancing scales. On one side, you're on a private island with £1 million. On the other side, you're dead or in jail. And absolutely everything you do in life pushes you towards one side or the other. And I just really like that, because it just reminds me that the small steps mean a lot in the long term. And the last thing is, again, something I like to tell myself. In dentistry, it's quite easy to think like, oh, I'm just doing people's teeth. I'm just a tooth cleaner. I don't actually mean anything. But you're not taking care of someone's teeth. You're taking care of somebody through their teeth. You're a patient is a whole person, not just a mouth. So just remind yourself, you're a lot more than just a tooth expert. You're a very valued professional. So that's just that. Like I said, it's a very quick one today. If anyone does have any questions or anything, feel free. Or after the session, I will leave my email and things if you do want to ask them there.
Perfect. We have a couple questions. Thank you for joining us today. So first question is it hard to get into dental school in the UK, and what GPA do you have to get into dental school?
What was the second bit of that question? Sorry.
Like, what are your grades to get into dental school?
Okay. Yeah. So it is. It's very hard to get into purely on a numbers thing. So there's only about 13 dental schools here. So I think it's quite similar in other countries as well. It's a lot easier to get into medicine in terms of like the places available. In terms of like academic, like the pressure, academic pressure of it, I will be honest with you. From what I gather and what I've researched about the Canadian route, it does seem easier in the UK from what they expect of us, especially because it's an undergraduate course. So everyone applying is 18, 19, rather than like 24, 23 with a lot more experience behind them. So I think they do expect, they do go easy on us a little bit. And in terms of grades, you have to be looking at, you definitely want to be getting A's, but I did a presentation a couple of weeks ago about what grade you need to get into dentistry, and I was shocked because I researched all the different boundaries for each school, and some of them accept B, so you don't have to be like a superstar academic to get in, but it's definitely hardest in terms of applications and the competitiveness of it, what makes it difficult.
Perfect. Another question is, what year do you start shadowing specialists in school?
When do we?
Yeah, like what year?
Okay, so in first year, that's when we first get introduced to the clinical environment. So we just kind of tend to watch patient activity then, but we don't get to do anything. Second year is when we start leading our own clinic. So we get our own patients just for simple things like scaling, polishing, simple fillings. And then third year is when we start getting put with consultants. So like going on pediatric clinics or oral medicine or outreach into the community. And then fourth and fifth, you just kind of build up on it from there.
Perfect. Another question is, what are some of your pros and cons of the dental school that you are attending right now?
Okay. So the pros of where I am, Manchester, I really like the early clinical integration. So like I said, we get clinical exposure from year one, we get our own patients from year two. There's a lot of other schools in the UK that don't do that. They have to wait to third year, at least in most of them. Another thing, we have quite a lot of resources at the University of Manchester. So it's the head of Cochrane Oral Health, which are the people that kind of look over dental research papers, and they're headquarters at the University of Manchester. So we get quite a lot of academic support there. Disadvantages is that as I talked a lot about the inquiry style base of learning. Sometimes I do prefer traditional lectures because I feel like you have to get very into, a group activity, and it's like constant kind of, it drains your social battery a lot. Sometimes you just want to sit in a lecture and get like fed information, but everyone's different.
Perfect. Another question is, what was the hardest thing about treating patients?
I'm going to be honest. I think it's the pressure of like dealing with the patient is fine because we get taught how to do it. We get phantom heads, you get your experience, scaling's all fine. It's doing that and kind of putting that into like doing the notes at the same time is what I found quite stressful, because when you don't have a tutor there leading like that initial consultation, you kind of panic and think you're going to forget something. Am I writing down everything? And I just say just the pressure of just making sure you get everything done in an initial consultation, because you don't want to miss things as many times as you get to practice.
Perfect. Another question is there something that you didn't expect to encounter in dental school?
That's an interesting one. I'd say definitely the weirdest thing we've done, we had to do we did dissection work on cadavers and just for anatomy. And I think the weirdest thing they did was they gave us like a free roam dissection day where they just said, here's a fresh corpse, essentially. Pick an anatomical feature that you like and dissect it for us. So they just gave us some scalpels, and they're very weird. Another one just on the back of that, we had to do lab work with saliva, and they wanted us to get a class average for what the average salivation rate of the class was. So they made us all dribble into test tubes in the dark. very weird for like 10 minutes just to get, yeah. Definitely that's not something I expected.
Another question is, do a lot of people drop out halfway through dental school since they are pretty young and they might not know what they want in the future?
That's a really good one. I think on my course, I think we're a cohort of about 74, so 74 in my year. I think we had one or two fall out in first or second year, but we don't get to know the reasons to that. It could just be like exam failure, because here you get to sit your exams the first time, and if you fail, you get one resit. But if you don't pass the resit, you're kicked out essentially. Like you can't resit the year, so you do have to pass every year in order to like get the whole degree. But yeah, it's not, I wouldn't say like a massive amount of people drop out or anything. It is just the odd few. And I think it's mainly due to failures rather than like decisions.
Perfect. Another question is, how do you balance with stress or manage work-life balance?
Well, I'm finding it quite easier at the moment because we don't have clinic because of coronavirus. So we're not seeing patients. So it's quite nice being at home. So I get to study from home, but usually, I just like to immediately switch off. So as soon as I get in, I have to take every like clinical, whatever I had on, like smart trousers or whatever, get changed into comfortable clothes. I think I kind of separate into clinical days and non-clinical days because that's how I separate the whole course in my head, because I need my clinical experience, I need my academic. So I kind of split it that way. But I think it does take over your life a bit. Dentistry does become your life. It has to. It's not an easy course, but if you enjoy it, it doesn't seem like work. But I'm not going to lie and say you're going to have the same work-life balance as other courses, because you won't. But if you enjoy it and it's something you really want to do, it doesn't seem as much as a downer.
Perfect. Speaking of TikTok, what is the most common misconception you've seen on social media about the dental field or about teeth?
I've seen a lot of, I think the most controversial thing I've ever said on TikTok is spit, don't rinse. People just really don't seem to have I get attacked for that all the time when I say don't rinse your mouth after toothpaste. There's lots of like fake whitening. I get all sorts of kitchen ingredients being asked to me. I think the most recent one was turmeric and baking soda. So yeah, lots of different tooth whitening recipes shock me all the time.
Another question is there something you wish you did different in dental school?
Oh, it's a good one. I'd probably say hold onto my notes a bit better, because I don't know, this is just a personal thing for me. And I don't know what I did with my first year notes. They've just disappeared. And at first year is when we learn all of like the core kind of fundamentals. And I just, so my advice would probably be just get like a nice note system from day one of dental school and try and stick with it. Don't chop and change, because I've got some stuff on paper, some stuff on iPad notes, some stuff on typed notes, and yeah, get it together before you start would be my advice.
Perfect. Another question is, how are the professors in dental school in the UK? Do they care about the students' overall health and learning, or how is it like in dental school?
It's quite sweet actually. I think because dentistry is quite like it's like a little slice of the NHS. Is like, I think everyone in the NHS always has this kind of like national healthcare spirit about them. So I think dentistry just kind of carries that as well. The tutors are very nice. The ones I've had, they've been amazing. Especially the ones on clinic with me. We have quite like a high ratio of like staff to students. So I think clinics at the moment for 4th and 5th year, they're actually 1-to-1 tutor to student. So we get a lot of time, a lot of feedback. We have like an online feedback thing as well. It's really weird. So whenever we do like clinical work on fake teeth, we submit the teeth and then tutors will like post feedback for you online, and like it's nice having it written down. But yeah, they're very welcoming. Yeah.
Perfect. Another question is, how do you learn without patients due to COVID?
It is a struggle. We have obviously lost out on a lot of experience. I mean, it's quite easy to give us the knowledge, which is what my uni's tried to do. They've pre-recorded quite a lot of seminars and expect us to like go through them in our own time, which of course isn't the same. So I do feel like I've missed out on like, a year's worth of seeing patients. I've only seen, I think, 3 patients at dental school, where realistically at this point, I should have seen about 30. So yeah, we have missed out a bit, but I think September is when they're promising to, ramp it up again. So they have put out a roadmap So unfortunately, it's not in our hands at the moment. We can just hope that they find us some time to make up for that time. However, there is some talk of extending our course by a year. That's what they've done in Scotland. So they're going to have to do next year of dental school basically. But that's something they didn't want to do to us. But it might come up again.
Perfect. Another question is, do you plan on owning your own practice after graduating?
I think it's every dentist dream. Like everyone says, I love to own my own practice. I think it's a lot more common to be an associate. I think that's probably something I'd lean towards purely because I just like the freedom of it. I don't like being fixed to a practice. Quite non-committal. I want to be able to get a different job if I want to. So I think working in secondary dentistry attracts me a bit more. So like a hospital setting, so something like oral surgery or oral medicine. So I think for that reason, I'd probably stick with associate. But
perfect. How do you improve your manual dexterity?
Well, we get quite a lot of practice. They have sent us what my uni done. They've sent us like chalk teeth and some scalers to practice at home. Another thing I got recommended to do, I haven't tried this yet, to get like an adult colouring book, like the ones with the like quite complex patterns, and then get like a mirror and then try and colour it in the mirror so everything's like inverted. That's what we get told to do. I haven't tried that yet. I'm not sure. I think I haven't had like a reason to try and ramp it up yet. So if I mess up a filling, then I'll get back on it. But I think the clinical skills sessions I'm getting at the moment is good enough.
Perfect. Another question is, does your school provide your metal materials? Because I know in the US we have to buy our own.
What do you mean? Sorry, like
the materials that you have to practice with.
Oh God, no. They pay for everything. Like it's kind of criminal how much we do get given because we just go through so much stuff. Like we'd have like a dispensary, so like just like in a practice, and we can just go up and just ask for whatever we want for whatever thing we're doing. And if you mess it up and have to go again, like I think I used GIC, like the little packets of GIC. I think got through about probably 10 of those because they kept setting before I got it into the gun in time. So yeah, they're not cost isn't an issue somehow. They seem to have an unlimited supply of materials.
Well, lucky for you guys. How's your study schedule? Is it a lot like high school for you guys, or how is it?
It's decent. I mean, our contact hours have dropped quite a lot, which means it frees up a lot of independent time for me. So I've been trying to utilize that, trying to like guide my own revision a bit. I think just because our course at Manchester, like I said, it's quite inquiry based, we don't have a lot of contact hours. So typically other dental schools, they might have like 20 to 30 contact hours a week. So, quite heavy here. It's about 2 contact hours a day. When I was in second year, I started dental school at 9 and I was finished by about 11 or 12 every day, just because we're expected to kind of follow our own learning and, teach ourselves basically. So we get, it's very, very self-led here. So you get a lot of free time.
Perfect. Another question is, how's your study schedule? I already asked that. What's the hardest procedure that you've done so far? Or what's the hardest class you've been in?
I haven't because I've only had to do to see 3 patients. The most I've done is, like I said, GIC. I haven't had anything too complex yet. I think what was quite tricky, I was nursing for a 4th year who was doing an endo, multi-rooted molar endo. And this is the first time I'd encountered endo in the clinical environment. Before that, it was all just theory and in clinical skills. So I'd never actually seen it and had to deal with the stuff before. And so that was probably quite challenging for me to try and assist her, not actually knowing how it's supposed to go in practice. But yeah, you pick it up as you go along, and all the older years are quite happy to help you when you're helping them.
A couple last questions, but what's the class size in your university?
So an average year, I think the 74 in my year, it ranges between 70 and 80 per year. In comparison, I think the med school at this uni is about 400 per year, so we're a lot smaller. But then we get taught in groups of 10, so we're in small seminar groups.
Perfect. And someone asked, in the US, basically everyone has to wear certain scrubs, colors, and everything each year. Is it like that in the UK too?
It's similar. So we all have like the same blue tunic uniform, and then we just have different badge colors. I think my year's yellow, and then you carry your color with you as you go up. But yeah, we have to pay for them. We have to pay for them ourselves. They're not too expensive though. I think they're about £30. But they are giving us scrubs as well. I think because of Corona, they want us to get back on clinic, but they want us to go like full, hospital scrubs. But they're paying for those ones.
Perfect. Another question is, do you have a lot of clubs in your school?
Like societies, yeah. I think so Manchester's the biggest uni in the UK in terms of like student numbers. So I think we've got the most societies as well. We're definitely quite big on sport here. Probably not as big as anywhere in North America because we're big on like English sport. I think everyone gets Wednesday afternoon off. Like no matter what course you're on, everybody has Wednesday afternoons free because that's when all like the sports clubs and like societies are. So it gives everyone a chance to like be able to do the same things.
And last question is, how are the exams over there? Like, do you guys have chapter exams or how is it there?
So here, it's going to be online this year, but I'll just tell you what it would be like normally. So we'd just go into their like computerized exams. So it's on like a little computer in like a little booth. I think we have multiple choice segments. We have like one exam that's multiple choice questions, one that's like a short answer paper. So like 2 mark, 3 mark questions, quite short clinical questions. We have OSCEs. I don't know if they have OSCEs in over there, kind of like doing clinical stuff. It's kind of like a practical exam. So they'll say like put a rubber dam on a patient and then they'll assess you doing it. So we have like those kind of exams and they like check you off at each point, make sure you're doing everything. Or it might be like, I don't know, check this patient's blood pressure or anything clinical. So those are OSCEs. And then we also have some coursework as well. So we might have like essays that are worth like 2% of the year and it all kind of adds up together. But I think it's about 60 to 70% exam. So mainly exam and just a little chunk of coursework.
Perfect. Thank you for joining us today. We learned a lot about dentistry and how dentistry is in Manchester. So thank you for joining us today.
That's no problem. It's lovely to meet you as well.
Thank you.